All right, we're gonna do it and delete that.
How do I do Facebook?
Are you everybody on the computer or their phone?
I'm on my computer.
I'm on my computer.
Okay. I'm trying to say, wait, make this thing any bigger, Jesus.
Are you on your phone too?
Yeah.
Okay.
Sadly. Hey, Orlandina, if at a point I decide to log in through my my computer, can you let me in?
Yeah.
Okay.
I'll see you. You'll come on the bottom of my screen. I will see you.
Let me in.
All right.
Okay.
Let me in. Just start knocking. All right.
I'm about to
populating people. We are going to enter the broadcast studio. Say it again.
I'm going to enter live on my Facebook. I'm going to share it.
Okay. Yep, that's fine. Go ahead and do that.
Okay.
Let me know when you're ready. We are on Facebook. Oh, good. We're in. We're on Facebook now.
Okay.
Hey, everybody. I'm going to get that intro down.
Oh, my.
All right. Hey, Fifth Fam, this is your girl, Orlandina Balan, and I am the Fitter Woman. I'm welcoming here with us tonight, we have Dr. Tameka Duncan, Dr. J. Michelle Martin, and Dr. Suze-Elisha Principal. These are all doctors and doctors of physical therapy and movement, or they are also known as movement specialists. Okay? So these ladies are here to help us become better athletes, or better proportioned athletes. So one of the issues that we tend to have as athletes is the fact that many of us, we go through the whole season, we prep, we eat right, we train hard, we cut down, and then you get on stage and you're like, okay, all right, it's okay. But now you're asked to pose, or you're asked to move, or whatever the case may be, and you're finding that there were certain deficiencies that you had at the beginning of the season, and now they're still there. Or there's this crick in your shoulder, or this crick in your neck, or this ache in your knee that never quite seems to go away. Now, as athletes, we look so fit and so healthy, but then when we start really moving, we realize we're not as fit and healthy as we thought we were. We can't move. Because I have a problem with, I'm all fit, and then I'm trying to get up off the floor, and I'm doing that, that moan and groan. So how does physical therapy help us move better? And I know people go to physical therapy for rehab. I get that part. But I know that from my own personal experience, physical therapy does way more than that. Because I have a problem with, I'm all fit, and then I'm, trying to get up off the floor. Okay. Sorry about that. Oh, that was on your end? Okay. All right. So, Dr. Duncan, what is physical therapy?
So physical therapy in a nutshell, we are healthcare professionals that we consider ourselves to be movement specialists, the movement experts that optimize the quality of life through exercise, hands-on treatment, and education. That's pretty much it in a nutshell.
Okay. So now how does that help the athlete? How does that help? Like, we know we can go to you guys for injuries and things like that. But I know that we can come, are there other times that we can come see you? And what does movement specialist mean? I'm sorry. What does movement specialist mean in terms of an athlete?
Right. Okay. So to kind of break it down a little bit further, I think it's important that people understand the education that we have. So we have an extensive education in anatomy, physiology, biomechanics, just the movement, the nerves, everything related to the body and how the body functions and operates. So movement specialists, you can consider us movement specialists because, if you're not moving well, we're the ones that can get to the root of the problem. Is it a nerve issue? Is it a muscle issue? Is it a joint issue? We can see that. We're trained to see and assess that, but then treat it to optimize your movement. So how and why is it beneficial to an athlete is because optimal movement is important for athletes. You know, you need to move quickly. You need to be efficient with your movement, because that can be, you know, the efficiency with your movement can make or break you winning a race, or winning your competition in terms of your posing. So we help, if we see something going on, we can help improve the quality of your movement to help aid with your performance. Does that make sense?
Yeah, that makes sense, Doctor. So, Dr. Principal, how, you know, what Dr. Duncan said that in terms of as an athlete, it helps us to improve our performance. What are some things that athletes need to be aware of? Like, what would be the indicator that you need to go see a movement specialist?
I think oftentimes
once we're injured, but you know, I'm sure there are things that tell us ahead of time.
Yeah, I mean, I think oftentimes, and then I think physical therapy, unfortunately, is I think connected oftentimes to injury. And I think it's like, well, my back hurts, okay, therefore I need to go to the therapist. Or my ankle is sprained, therefore I need to go to the physical therapist, versus looking at it from a perspective of, you know, listen, like, as you would go to the dentist and say, listen, I need to get my annual checkup with my dentist to make sure my teeth are okay and make sure my teeth are performing optimally, right? So that I can chew and therefore don't lose teeth. But in the sense of physical therapy and saying, okay, let me do this assessment of myself and just see how I'm moving. And as Dr. Duncan said, am I moving efficiently? And with that, translate that over into sport and other things. But just looking at it from a different perspective of not necessarily that I'm in pain, but maybe, okay, maybe I need to get a checkup and make sure I am moving efficiently. You know, when I'm like, if I'm an overhead thrower or I'm a pitcher, am I getting adequate range of motion so that I can, you know, release the ball? You know, if I'm a gymnast, am I getting adequate lumbar range of motion so that, or low back motion so that I can do a back handspring, right? So it's just making sure that you're moving optimally and efficiently. And because we kind of understand movement and we understand what should move and how it should move, I mean, that's how I think you should best look at us, not necessarily from a pain perspective, but more so from like a range of motion, and maybe I'm a little stiff in an area, and maybe I need to get that looked at.
So by looking at your movement and what you do on a regular basis and training for that, and not even training for that. If I do have to be able to go, see, right now I'm already like, oh, wait a second, I don't train for that. I don't train to be able to do that. I train to be able to build shoulders. Exactly. So, you know, that's something I need to work on. So to be able to train, to be specific in your training. And so if you're specific in your training, then you have to be specific when you're coming into your movement specialist, to your physical therapist, that will allow you to be even more productive in your training. So I'm saying Michelle.
That's fine.
Dr. Juan Michelle Mitchell. So in terms of physical therapy for the athlete, when we're looking at these movements and we know that, hey, I'm feeling some kind of restriction here, what do you tend to see from most athletes when they come in? Do they always come in for injuries, or do they come in prior to an injury, or do they feel some kind of stiffness?
Unfortunately, as Dr. Principal alluded to, you're not going to find a lot of athletes unless they understand the concepts of physical therapy, unless they understand that we're not only biomechanical specialists, and we don't only look for, because your body's made up of a number of systems. How those systems relate to one another is what's important to optimizing performance. We need all things flowing together, right, to be a well-oiled machine. Unfortunately, a lot of athletes will tend to come for therapy, for treatment, when they've suffered an injury that prevents them from being at their peak, prevents them from doing what they need to do. You will find some athletes, however, that are, you know, maybe their coach is aware of these things. Maybe they have had prior experience and understands the benefit, or, you know, have benefited from that experience, that will then come in to see a therapist or to see somebody to help them with whatever issues they're having. In my particular niche, I may not necessarily see athletes with pain, and I'm not necessarily going to see athletes, you know, who are complaining of, oh, I can't move this, I can't move that. I'm a pelvic floor therapist. So I'm going to see athletes who may be leaking. I might see athletes who may not have a lot of power, because we also have to understand that the power Lack of movement, lack of strength, lack of mobility is going to affect your output, your power output, especially for explosive sports, especially where we need a lot of strength, especially where we need to be very, very dynamic. And so for a lot of my athletes that I see, I'm seeing them because they're not having efficient movement, they're leaking or something of the sort. So it's not necessarily, in my case, associated with pain. And I think it just depends on the athlete, the sport, and what might be going on with them.
Well, you know what? We might as well just start with you. Each of you have a specialty. Hey, you here? You put it out in the bag. So each of you have a. You did. So we're gonna start with you. Each of you, even though you are all doctors of physical therapy, and it was in speaking with you and having my own personal experience with physical therapists that a lot of times, you know, we have doctors of physical therapy, but there are actual specialties in it. Okay, and hi, Jose. And each of you have a specialty. Yours is pelvic health. Pelvic floor health. Can you explain what that means? Because you were saying, you know, I see athletes that are leaking. So what does that mean? I'm like, leaking through your eyes, leaking through your
like
bladder,
Oprah. Like, I've got a pelvis. You got a pelvis. We all got a pelvis. I'm like Oprah.
I'm looking at my chair, find a pelvis.
Right, you might find it. So
grab it.
And if you look at this, right, and I love to show the pelvis because everybody goes, oh, but you know, you see your spine, you see where the hip connects, you see all these joints and bones, you see your tailbone. The pelvis is in the middle of the body. And the pelvis's job is to support the pelvic organs, obviously, reproductive, bowel, bladder, but also to stabilize the body as the extremities move. So my job as a pelvic floor therapist is not only, if I'm working with athletes, not only optimizing movement as it relates to hip, low back, knees, because usually there could be an underlying pelvic floor issue, but more specifically the pelvic floor in its supportive role, in its stabilization role. Sometimes it falls short for one reason or another. And when that happens, we can get issues like pelvic pain. We can get issues like leaking. We can get other issues, more personal, you know, such as sexual dysfunction. But for the athletes, most of them are coming because they're leaking or they're having some sort of pain. A lot of athletes, they're strong, they're muscular, and we don't necessarily associate them with having these types of dysfunction. But if the muscles are not coordinated and not functioning right, if the neurological pathways are not what they should be, you're going to have some dysfunction because, again, even though the body is made up of all these systems, if the systems are not functioning well together, then we end up with a problem.
Now, when I hear pelvic floor, I know I immediately think, oh, this must be a women's issue. Is pelvic floor, pelvic health is only something that concerns to women?
Not at all. Not at all. So actually, men can suffer from pelvic floor dysfunction as well. A lot of the athletes that I will see that are male tend to be cyclists, and they're tending to come to me for pelvic pain typically because of irritation or compression of the pudendal nerve. And there may be some other men who are dealing with other things with their lifting, pelvic pain and stuff like that. A lot of the time, though, we tend to see women more so with pelvic floor issues. And this happens, I mean, for a number of reasons. You know, we're the ones having the babies. We tend to go through a lot more physical changes because of, you know, hormonal input, childbearing, things of that sort. So we tend to go through a lot more physiological changes that can impact the pelvic floor. And so we tend to often see pelvic floor issues occur more often in women than men. But men will have issues. Children can have issues. I've treated gymnasts. I've treated youth athletes who've had pelvic floor dysfunction. Because then we also have to look at those who are participating in impact sports, the gymnasts, you know, all that pounding. Again, they got a lot of muscles, but if the muscles are not coordinated, if we don't have if the muscles are functioning, they're too tight, if they're not, if our techniques are not right, if our breath is not what it should be, then we can have these issues that are perpetuated as a result.
And now, how would somebody know that they're suffering from this particular? Oh, I have somebody here on Instagram that says, "I need her."
Yeah.
So
DM me.
Yeah, the pelvic floor specialist. You'll see her information on the flyer. She's like, "I need her," and this is a person that actually she competed. She's a figure. She was figure. She, you know, since got married, had a baby, and so she's going, you know, her body has changed, but this is somebody that is and an athlete. So so now you have her information. You can definitely get in contact with her. So how would somebody know that they're having a pelvic floor dysfunction?
So usually pelvic floor dysfunction can take the form of bowel, bladder, sexual dysfunction, and or pain. You can have leaking of urine or feces. You might have urgency where it's like, you feel the urge coming on to go to the bathroom, but you can't control it. You can't hold it. You may feel hesitancy, so you may not be able to start a urine stream. You may not be able to defecate. You may have pain with intercourse. And even though intercourse is not specifically related to your function as an athlete, you're an athlete, you may be married, you have a spouse, a partner, if you're having some sort of dysfunction there, it can transcend to other areas of your other aspects of your life. Typically, you could be having pain, and not just pain with activity, not just pain with intercourse, but just generalized pain. You may be having persistent back pain, because again, when you look at the spine, you see this is a spine here, goes into the sacrum, into the tailbone, and all the pelvic floor muscles attach at the tailbone, all the deep pelvic floor muscles, that is. So if you're having any issues there, if you're having any concerns with sometimes the movement, you're doing a squat, you really can't get into that deep squatting position, we need to look at the mobility and see what could be going on there. If you're having persistent hip pain, because, one of your deep hip rotator muscles actually attaches in the pelvic floor. So if you're having some of these issues, oftentimes it can be a sign that you as an athlete are having a pelvic floor issue.
And I like the concept you were discussing in terms of the mobility of the hip. Dr. Duncan, is every exercise made for everybody? And I'm using that word everybody. We go and look at these magazines and, they tell you how to squat. Want legs, you got to squat, you got to do the leg press, you got to do the leg extension. You want this. Is every movement really, can everybody, and I'm using the word separately, can everybody perform every movement?
Absolutely not. And that could be a number of reasons. So for whatever reason, I couldn't hear Dr. J's, I can't hear her audio. So I may say some things that she may have stated earlier. But everybody's body may not be able to tolerate the same movement. And that could be a number of different reasons. I saw her pointing to the SI and the hip. I always tell people this, if you can't do a normal squat, like if you go into a squat and you feel yourself restricted, like you feel like, man, my hip feels tight, or I'm having this, my knee feels tight, or my ankle feels tight, and it feels that way just unweighted. Imagine what you're doing to yourself when you start to load weight. So if you're doing a squat rack or anything like that. So yes, everybody wants to do the same exercises, but if your mechanics are not there, you can do it, but what's the consequence of that movement? And then that's where you continue to load on a joint that's not moving optimally. A lot of times, if a joint isn't moving the way it needs to, the surrounding musculature is going to be inhibited. So now you jeopardize, okay, is my body compensating for movement? Because the body's going to do whatever it needs to do to get the job done. It may not be the best, but it's going to do whatever it needs to do to get the job done. So a lot of times that's how people, they can injure themselves, because they're pushing their bodies to do something that the mechanics are off and it can't do it optimally. And so now you have this issue, okay, you're flaring up your tendons, or you have this muscle that's inhibited. And so now you're overworking another muscle. So everybody may want to do the same movement, but everybody's body is not capable of doing the same movement up until you get the proper assessment, treatment to address whatever your issues are, to then restore the normal movement.
So then you're saying that once those issues are addressed, then you should be able to perform that movement. So do you think everybody, like, for example, like I always say the squat, because that's one of the movements that some people don't have the mobility or the flexibility to do or get into the squat. So does that mean that everybody can eventually get into a squat, or not so?
I think so. I mean, I think that's one of the beauties of us as PTs, because again, we assess movement. So a squat analysis is a basic assessment that I look at when somebody comes in my door. Looking at somebody's squat tells me a lot. It tells me what's going on at their ankles, their hips, their knees, their back. You know, if you involve the arms, it tells me what's going on with their thoracic spine, their neck, a squat tells us a lot of information. And then based off what we see, then that's where we start to break down or look at the joint or those areas a little bit more thoroughly. And then once we see and assess and find what the problem is, that's where we create a specific plan for that person to then, to restore whatever the issues are, to then get them back to doing a squat or running or whatever the task at hand may be.
Dr. Principal, I'm going to shoot this question to you, and it's going to piggyback off of Dr. Duncan's question. And the question to you is, I always tease you both, because all PTs, I notice this. You guys have like little scanners for eyes. Anytime it's like, and they're like, okay, this is going wrong, this is going on, and this is the movie's book. I'm like, oh my gosh.
Right. Yeah. You have to turn it off.
You can't turn it off. It's like,
you can't turn it off.
Turn it off.
Scan it. I'm like, it's scary, but you'll be like, oh, this is tight. You're not moving properly. What is it that you're looking for? Because Dr. Duncan said the squat. I'm like, to me, like the person sitting, I can tell you they're stiff. I can tell you certain things, but you're like, it can tell me a whole lot. What is it that you're looking for when a patient comes in to into your practice?
So I'll say this, and I can speak for probably all of them at this point, I think. It's true because, the example I give is that my desk faces the window. So as a patient is walking in the door for their initial consult, I'm watching them move from the moment they get out the car. So if the prescription says the person is coming with, perfect example, I have a guy that basically fractured his pelvis. Perfect example. So there's certain things I'm looking for him to move a certain way. Maybe he's leaning his trunk over to the side, because where his pelvis is, as Dr. Juan will tell you, that's where a lot of the, those glute medius muscles are that are going to control for kind of that single leg stance. So is he tipping to the side when he's walking? Does he have a stiffer leg gait? Is he stiff when he walks? And that kind of gives me information just with him walking in the door. When he signs in, when he sits down, I'm looking at how does he move from standing to sitting, and that's a squat. So when we're asking patients, can you squat? And they're like, oh, I don't squat. But ironically, when you get down to the toilet, it's a squat. When you're sitting in a deep chair or couch, it's a squat. And that's all movement, and we compensate and we move differently. So depending on what the person is coming for, I'm looking at those surrounding joints as they walk in the door and as they're moving. So I can kind of base my prescription, my assessment. We therefore ask questions afterwards, because a lot of therapy is really just listening, and it should be just listening, unfortunately, but, to a certain degree, unfortunately, because we hear a lot of things. But, they're telling us and they're giving us tells as to what's going on. So if that same person is telling me, listen, I fractured my hip, and maybe it was an old fracture of their pelvis rather, and they're telling me, listen, I'm having issues with walking. Okay, I saw that at the door. What are the things? And they're kind of telling what's wrong with them. I'm having issues with squatting. I'm having issues getting out of a chair. I'm having issues coming out of the car. I'm having issues picking something off the floor. And then that leads me to my exam as to what I'm looking for mechanically and or functionally with the patient as they go through the assessment with me. So yeah, those are the things. So we're looking as soon as they walk in, but then the assessment based on what I've seen and the conversation I have becomes a little bit more honed in, because I've kind of listened and I've also assessed.
Dr. Juan, I'm going to come back to you. When Dr. Principal was talking about how she assesses the body, she speaks to her patients, she's trying to find out more, trying to find out information about what has happened, how they're moving, what occurred before. Do you find that patients understand what is going on with your body, or do they kind of tell on themselves when they come into your office? Like, do they not realize what's going on, or do they just know certain things? But as you speak to them, do they tell on themselves? And if not, how do you unravel that information and get that out of them?
So I'm going to give you two answers. First, going back to Tameka's, Dr. Duncan's response, I agree with her in the sense that with the movement. But one thing I will say is that we all can be biomechanically different. And so in looking and assessing, which is why we can't give the same prescription to everybody, and which is why we talk about that assessment. Your body is going to be different from my body. It's going to be different from the next person's. Biomechanically so. Your hips are going to sit in the sockets a little bit different than mine may. I'm also 6 foot tall. You know, if you're 5'1", you know, what my squat's going to look like is going to be a little bit different. So that's where that assessment is key, because we can't just go off of the fact that this person should look like this or this person should look like that. That being said, when people come in, I feel like some people tend to be body aware and some people aren't. And it really just, you know, I've met athletes who are not very body aware. Then I've met, you know, a lot of people who are. It really depends on the person that's walking into the door. Again, if they know they've got a problem, if you've got those athletes that are very in tune, they're going to be their issue. They might not know what's happening, but they're going to tell you my performance is affected. Then I want to know specifically why that is and what that is. What is it that you can't do? And I want to look at them. You know, if they're telling me, hey, you know, I can't go into this overhead movement, like my overhead movements are shot. I don't know what's going on. I'm having pain. You know, first of all, that alone tells me what I need to look at. Well, one, I want to see what they're looking like, what overhead movements, let's say they're doing a snatch, you know, do they have tightness in their lats? What does the thoracic spine look like? Are they having hip issues, and do they not have enough mobility? You know, is it like their releases? Are they too slow? You know, are they not dynamic enough? Where is the problem coming in? What is the movement translation? So their problem alone, listening to that, tells me a little bit of what I need to look for, because their sport, their function, that is their job. I need to help them do their job better. And that's going to vary from person to person. If a person's coming in and saying, you know, I've got a problem, I just can't get out of a chair. You know, is this only at home? Is this a low chair? Is this your workstation? Where are you having this problem? So it really helps to know their function and understand their function. It also helps if we're talking in the sense of athletes, what is their sport? You know, what is it that they have to do? What movements do they need to be able to master? You know, where is that performance that we're looking for? Are we looking at power? You know, can they do it, but they're just not getting enough power? Do they not have enough torque, enough mobility? Those types of things. So we're looking at that with each individual. As they come in, you know, like Dr. Principal said, we eyeball you if we can. If the office is set up in a way that we can, you're fair game from the time you hit the parking lot. Like, we're already scoping you out. Like,
right.
You see what you look like getting out of the car. You know,
like, do you need my phone number when we're dealing? What's going on?
Occasionally, you might have, and I think we've all had that one person who's saying, you know, they walked in fine, but they're like, oh my God, it hurts so bad. But I just saw you get out the car. There ain't nothing wrong with you. You know, I think we've all had that one person. But, you know, ultimately, we're looking at how well they do. Because another thing that people do really well, and sometimes unintentionally, is they compensate really well. So you still got to work. You still got to live. I've got this pain, right? And I still need to figure out how to function during my day. How do I do that? Well, what can I do to my body to accommodate for this so that I don't hurt anymore? And so oftentimes it's not even the movement that they need to be doing, but we're looking and assessing, are there any compensations that are occurring that we might need to address as well? So,
and taking me right into my next point, bodybuilding is a sport of specificity. Everything is very specific, depending on your division. If you're a bikini, if you are women's physique, if you're a classic or men's physique or bodybuilding, it's a sport of specificity. Your training is specific. Your eating plan is specific to whatever. And you said something. All of you ladies at some point said, you know, everything that we do is for that individual person. So I'm an educator, and in education we have something called an IEP for our special ed students. It is an individualized education plan for that student to meet their specific goals that they need to meet for the academic year. And those goals are revisited every 10 weeks, right? So when you have a bodybuilder or a physique competitor, and when I say bodybuilder, everybody, I mean everyone. I mean bikini. I mean, I'm speaking on women's physique, men's physique, classic physique, men's bodybuilding, women's bodybuilding, women's figure, can't forget them. So I'm speaking on everyone. So when you have these specific body types that are trying to meet specific goals, how does your practice, how does your, I know that Dr. J. Martin Michelle is hers is floor specialty, but Dr. Duncan, you are ortho, and also Dr. Principal, you're also orthopedic?
Yes, I did my board certification.
I'm sorry, say it again?
I did my board certification in orthopedics, yes.
Okay, so how, when a bodybuilder comes to you, how do you, and I'm leaving it open to whoever wants to answer this, how do you create this individualized plan for them so that they can, because the goal is every season to improve. So what is it that they have to do, or what is it that you do to help them meet those specific goals?
I'll start. Yeah, I'll start. So everybody, like we said earlier, everyone is different. So my first question will be, what is their perceived problem? Like finding out what their issue is, where they see their problem is coming from. So if it's something, if they're having an issue with lifting, you know, hey, I notice every time I try to do an overhead shoulder press, I'm getting this shoulder pain and I can't lift, you know, I can't lift the way I need to train. You know, if it's that, or if it's, hey, I noticed every time I hit a back pose or I do this, one side seems like it's leaning, or my glute isn't firing here. You know, it depends on what the specific issue is. And then based off of that, then that's where I'd go into doing my assessment. So if we say, okay, let's use the example of a shoulder. So if something's going on with the shoulder, what you may see in that athlete is, you know, they may not be able to get the same shoulder cap, you know, so right side may be well developed and left side is lagging behind. My specialty, my area of specialty, as I say, is the spine. So for me, I always go back and say, okay, what's going on? Is this joint? Is this muscle? Or is this neurological? And so I always start by clearing the spine. And basically what that means is it's determining is a nerve not communicating to a muscle properly, you know, to affect that muscle's ability to do what it needs to do. So if, you know, depending on it's so dependent. I hate saying that, but it's really patient dependent. It depends on what the issue is. So I always use this example. This is a perfect example of what I was talking about. I had a patient a few years ago. He was being seen at another clinic for, I think about 3 months for knee pain. And wasn't, you know, knee was hurting. He wasn't able to really do much. He didn't have much of a quad contraction, etc. And so he had extensive PT for 3 months. And he came to my clinic, and, you know, I did my history, kind of understand. I said, okay, you know, understood everything he's been through for the last 3 months. And I, you know, just clinically thinking and doing differential diagnoses, it's like, okay, if this is if it's just a knee injury and it's purely knee strength, weakness, it should be resolved. 3 months, we should see some improvement. And he was like, we've been doing this, we've been doing that, and nothing's the issue. I said, all right, has anyone checked your spine? And he said, no. I said, let me look at your spine. Did a spine assessment on him and noticed some things. And literally, so he was unable to, like, if he was sitting in a chair, he was unable to straighten his knee out and hold it to resistance, right? And so I assessed his spine, did a couple mobs did some manual therapy on his back, not even 5 minutes worth, and reassessed. I said, okay, let's try this again. Retested him, and he had all his strength. It wasn't a knee issue. His issue, he had a nerve issue. So his spine was putting pressure on a nerve that was affecting the nerve's ability to communicate to that muscle properly. So he was walking around with a painful knee. It was weak. It was giving out on him simply because a nerve was putting compression on it from the spine. So
now, I'm sorry, something like that, automatically I'm thinking, hey, if I'm trying to work on my quad, I'm trying to do a knee extension, and, you know, I'm like, oh, you know, there must be something wrong with my knee. So something like that can affect the progress that I'm trying to make to develop my quads.
Exactly. And so, you know, that's what I said. It's really patient dependent. So when it pertains to the bodybuilding population, like you said, everything is very specific, and you're being judged on the way your body looks, the symmetry. And so something as simple as that is like, man, I'm killing my legs, I'm killing my shoulders, but it's just not growing. Okay, there is something more going on other than just this muscle is weak and it's atrophied. That's where, you know, a skilled clinician like a PT would be helpful to do a little bit more of a thorough assessment to see, is it just muscle strength? Is it just that deficit, or is it something else that's contributing to your problem?
Dr. Principal, you know, everybody was using this term compensation. And I always think of, you know, as an athlete, you know, you feel a little achy, you feel a little sore, and you're just like, go hard. You know, you got to always push through pain. No pain, no gain, right? That's the concept that we have in our minds. Just train anyway. As long as it's not gonna, if it doesn't kill you, keep training. What do you think about that concept, and how does it connect to this concept of compensation? So that mindset of, you know, no pain, no gain, and the concept of compensation.
So, I mean, me and Tameka kind of have that in common in terms of lifting. And I think it comes in this comes into play here where it's like, okay, we're going to lift to failure, right? So you get to a place, you're like, okay, well, I'm hitting failure. What is that really? Is that I'm going to go until my form begins to suffer? Or do I stop when maybe, you know, in terms of muscle, I've hit fatigue? You know, so there's that where you go to the gym and you're watching the guy. Perfect example is probably where people typically injure their bicep, and particularly with front raises, right? You see them throwing the weights, and then after a while, so the shoulder actually is bicep and supraspinatus in terms of flexion. But then after a while, your upper trap will actually kick in because it's also an elevator. And then next thing you know, you're getting your upper trap is kicking in. And then now you're coming back with a complaint of neck pain because you pushed past what would be seemingly failure. And now you're compensating, and now other joints and other tissue is involved. So I think it's kind of understanding what what that is for you. And it's dependent on every person, because we can give a patient and say, listen, let's do these exercises and let's do 2 sets of 15. And for one person, they can get through it and they're like, oh, that was easy. And for the next person, they're hitting, you know, a point. So then now you're seeing all these compensatory, these other muscles that are kicking in that you don't want to kick in. You know, like the person that's doing the knee extension and alternate, now they're off of the chair, and then, you know, now they're pulling through with their hip. But are you really not pulling from the quad? Are you really not pulling from the quad?
Right.
Or pick a range. I mean, particularly like if you see somebody kind of pulling out and doing external rotation, and they're going, and
the whole body flies.
You know, everything is just
the whole body's flying.
Like, you know, and you're trying to.
We always see somebody at the gym. You always got somebody. They're doing all of that.
They're trying to flap their wings.
You know, but
it looks impressive because they have these crazy size dumbbells. But are you targeting what you're training?
And now, I mean, even when you go online, I mean, and you look at some of the athletes now, like a perfect example is vitamin C as an example. You see, she doesn't lift very heavy.
Right.
Her movements are very controlled and contained. If she's gonna give you a front raise, it's gonna be a nice clean front raise, and she's gonna give you those reps, right? So she's really working efficiently within that range of motion, right? Because there's a certain range of motion that all joints have. So if for whatever reason you're stiff, right, and maybe your arm, maybe you're getting, you know, good range of motion in that one, in the one arm it's, you know, normal, but maybe the other one is not moving as well, and now you're compensating, right? And now you're giving me this front raise that's weird, and then now you have other structures that are being impacted. So I hope that brought on the analogy.
No, I think it did, because the thing is that as an athlete, and I want to really bring out to everybody, all of these ladies are athletes, and I'm going to present this next question to Dr. Michelle Martin. You know, every one of you are athletes. Dr. Duncan is a bikini competitor, and at one point was even nationally qualified. Dr. Principal is also you're also bikini as well, correct? No, figure.
Yeah, no, I'm bikini and nationally qualified.
You're bikini, and she's nationally qualified. Dr. Michelle Martin is a volleyball athlete. So all of these doctors are but she's retired.
Come on, girl. Tell them about Barbados. Tell them about Barbados.
Exactly.
Girl. Come on, tell them. Tell them about Barbados, girl. Tell them. Tell them.
Tell us what you did.
I was many moons ago, but I competed junior national. So I've been competing for a long time. I competed junior national and senior women's national team for Barbados, and I coached. So I've been coaching the last 20 years. I competed in college as well, and I continue to coach youth volleyball. So
I'm gonna toss this. That was that was basketball. Sorry.
I got
it. I'm gonna start.
You better bump.
Take the stain out but serve you this question. How important is it for your PT to understand being at the mindset of an athlete? Like my PT here in New York, Dr. Michael Camp and Dr. Sean, I can't say Sean's last name, I will be disrespectful, but Dr. Michael Camp and Dr. Dr. D'Amato of Bethpage Physical Therapy, these are all athletes. They are athletes, they train. And I found that when I tore my ACL, I had to have ACL reconstructive surgery a few years ago. It was really, really, really important that my physical therapist have either an athletic background or understand the mindset and how athletes work. How does your athletic background help you to connect to athletes?
I mentor other therapists, and I tell them if you get an athlete coming in and you tell them don't work out, they're gonna leave you. You will never have any patience. And they're like, but they need to stop. I said, no, they don't need to stop. They need to scale. There is a complete difference, because if I've played, and just even from personal experience, I broke a finger in the middle of the game, came off in the timeout, taped my fingers, and went right back in. There was no reason for you to pull me out. The adrenaline was so high, I couldn't feel nothing till like an hour or two later, and then I was like, oh Jesus. But you can't stop athletes from doing what they do. That is who they are. That is who they are. That is who they identify with. So you cannot stop them. Yep. So when you talk to athletes, first of all, you need to know their sport. You need to understand. You don't understand the intricacies of bodybuilding and the intricacies of working with that particular athlete, you are doing them a disservice. I work with CrossFit athletes. I coach volleyball. I work with a lot of runners. If you don't understand the intricacies of those sports, you don't know what a clean and jerk looks like. You don't know what their movements are supposed to look like. You don't know how to program their running. You're doing them a disservice, because you can't help them to train to get back to where they need to be. You can rehab them, but as far as helping them to return to function and return to sport, because we have to understand that with an athlete, their function is their sport. It's more than just, okay, I need your knee to be able to move. I need you to have full range of motion. That's all well and good, but how does that help me? Old people got good range of motion, but that doesn't mean they can run up the street.
That's right.
They need to be able to function within their specific sport. And so I feel like that, coming from the athlete, that's super important. And I hands down will tell any athletes that you need to find someone who understands. They also need to be tough enough to tell them when they need to go sit their butt down. Because the average person may not have the gumption to look at an athlete, especially a professional athlete, and say, here are your options. You could go compete, but you're going to need to have surgery, and then you're going to sit out all the next season. Or right now, this is not very important. We can take the time to rehab, and then you have the ability to preserve your seasons ahead of you. You have to be able to give them their options, and you got to be straight with them. But you have to understand their sport, their mindset, and what's at stake for them.
Perfect. Any Dr. Duncan or Dr. Principal, did you want to hop on that one?
The example, I think from a personal perspective, I lie to you not. I was probably about 4 months in, saw these amazing changes, and I dropped a 10-pounder on my pinky toe. I'm surprised I didn't take out all of them. I ignored it, and I kept going. I was like, I'm gonna just continue with these lunges on the broken pinky toe. But I didn't. I didn't feel it. I was like, I'm just sore. I'm fine. But between pre-workout,
you don't feel nothing.
I didn't feel anything. I was like, I'm good.
How'd you feel the next day?
Not even the next day, child. Not even the next day. I was good. Even
give her a couple hours after the workout when the body cools down. It never hurts during the workout.
Listen, there's an IFBB pro that's at my gym. And he was like, and he would check in with me every once in a while. He's like a proud father. He's like, oh, you can do it. You can do it. And he was like, are you all right? I was like, I'm good. And then like 2 seconds later, I was like, I'm good. I'm not good. I said, but wait. I was like, let me do something else. So I went and I squatted instead. So, but
But you need your toe to grab the floor.
I changed, but with therapists, I knew how to change the angle.
Yeah.
I know how to change the angle. So this is the gift and the curse. But
Right.
I say all of this to say, so later on that evening, I felt it. I took myself to the ER, found out it was broken. And I lie to you not, I didn't skip a step. I kept if you look at my iWatch, my rings kept going. And I just wrapped the toe. And then as opposed to running, which was on my program at the time, I decided to ride the bike. I decided to, I changed. I did the stepper, but I was just mindful as to how I did the stepper because I could step. However, I couldn't run or do anything that involved that flexion of that foot, that plantar flexion. Yeah. So, did my legs suffer a bit? Yeah, they did because I couldn't quite do the lunges that I needed to do to maybe fire my glutes, but I had to find other ways, open chain, without my feet on the ground to get those muscles to fire without me irritating my foot. So speaking from experience, there's ways to modify, and get the job done.
Mm-hmm. One of the things that I noticed is that working with physical therapists, Dr. Duncan, Tameka Williams, she says, this is amazing, Dr. Duncan. It seems like all potentially save people from having knee surgery that is unwarranted.
We say
so like by you
having a lot of surgeries unwarranted.
Mm-hmm. How is that?
Because we really do. Like I think one of the biggest things that one of the big things that you're seeing, like at a campaign wise, like in terms of the physical therapy profession, it's this slogan that says choose PT first. A lot of people have pain and injuries, and the first thing they want to do is like, oh, let me go to the doctor. Do I need to have surgery? Let me get it fixed. A lot of times, if you go to a PT, we help prevent people from having unnecessary surgeries every day. You can have it depends on lifestyle. It depends on severity, but I have treated so many people that have rotator cuff tears that they don't have to have surgery. We get them back to, pain-free movement. They're participating, doing their daily activities, reintegrated back into sports or whatever. A lot of people think it's a be-all. If you have surgery, it fixes everything. It doesn't. That's the first step. Now you have to go through an entire rehab process, Yeah. And then from that, once you rehab, now we got to build you back to, if you were that athlete, now we have to build you back to your athletic performance. So not just get back to your daily to walk and be able to get up and down and go up and down stairs, but we got to progress you back to running and doing all this, where if you would have chosen therapy first, or inquired of your doctor, which is about to bring up another great point I want to highlight.
Yes. Yes.
If you don't, if you state, not nationwide, but primarily, one of the big things that's going on is something called direct access. And what that is like Tennessee, we're a direct access state. What that means is you can come in off the street and I can see you without you having a physician's order. And we have enough knowledge, education to know, hey, if this is outside of our scope, so if it's not musculoskeletal or something, we have enough knowledge to say, you know what, I'm going to refer you back. I'm going to refer you to your doctor or to whomever, because you need further testing. And so the sooner you get in, when you're noticing these aches and pains and you get assessed and seen by a PT, oftentimes we can let you know pretty well off. It's like, you know what? I'm not 100% sure if conservative treatment is going to be helpful. You know what I mean? Like, just because it's something that we deal with on a daily basis, but we help we help prevent a lot of people from having unnecessary surgeries or delaying the onset of having a surgery.
And people got to remember, a surgeon's job is to cut. So if you go to a surgeon, there are not very many surgeons that are going to tell you you don't need to have surgery.
Yeah, I can't.
Yep, they're just going to go in. Yeah. Did you try putting your earphones in? You couldn't hear that statement?
I couldn't.
Yeah.
Let me go get
Okay.
Yeah.
Go get your earphones. Okay. Go get them.
I'll be right back.
All right. No problem.
But to her point as well, I think that also relates over into pain science as well, right? In terms of prevention. And I think that's where we are right now in terms of the country, right? Where at a point, so I'm licensed in New York, New Jersey, and Maryland. And I remember in Maryland, probably in like the mid 2000s, you know, a lot of the primaries were managing a large quantity of patients that were having chronic pain issues. And unfortunately, some of them just weren't unable to really truly manage that, right? So I would get patients and, you know, they would finally come to physical therapy and they were coming for like a back issue. And they said, you know, my doctor told me to come, I'm here. Okay, what can you do? And then you're sitting in the evaluation with them and you're like, well, how long have you had this issue? And they're telling you I've had it for a year and a half. And then in that conversation, you're like, okay, well, what are you taking in terms of medication at this time? And then they're telling you what I'm taking at the time. It was when Oxycontin was really big. So I'm taking Oxycontin. You're like, whoa, that's a pretty high level, you know, opioid that you're taking. And then they, you know, now they developed an addiction to that thing, or they developed a dependence upon that thing. So now it's more difficult to treat the patient because in their mind, they've got, I'm in chronic pain. And in addition to that chronic pain idea, is the idea that I need this medication in order to function. So now then you kind of saw the emergence of pain management doctors and more of a multidisciplinary approach between physical therapy, pain management, your primary care, just everybody speaking together and saying, listen, this is person A, let's talk about person A and find out the best way to wean them from this and get them back to optimal function. But in that same vein, you're seeing nowadays in terms of now the conversation is once again on pain meds, right? Where you're seeing an actual push in certain states in terms of physical therapy over pain management, where you're seeing, listen, because inherently there's a mind-body connection. If I put my hand on the stove, it's hot. I pull my hand off. So my body is sensing pain. And that's the same idea in terms of this gating of the pain theory, where, you know, movement, you can actually move, because I think a lot of people have this misnomer where, you know, like our parents, if I'm in pain, I need to lie down. However, there's a really great study, I can't think of it at the moment, but if you probably search it, you'll find it, that said, no bed rest. It's actually better for people that they get up, and that they move, because you're actually gating the pain and you're teaching the body, you know, that same athletic idea where, okay, I am hurt, but let's scale. You know, like my back is hurt, but I can still do other things, and maybe it's not the full range of motion that I can, but maybe a little bit more altered. So where you're seeing now that they're actually pushing physical therapy, where people don't understand, you have to educate them on that and the benefit of that. Listen, okay, you're here because, and then maybe we can try to see, and what you're wanting to see is a decrease in the amount of pain medication the person is taking over time, speaking to the fact that you're improving upon their function and their pain.
I love the fact that you went there. Yes, because there is a lot of that. You see a lot of people not. You got it. Exactly. You threw the ball. You caught it. now we got to do the don't rush challenge. Now you got to throw it up. Throw it back up.
Jay's up for me. So.
Jay's above me.
I got you.
Jay, I want you to piggyback off of what Dr. Principal said in terms of the mind-body connection. And we're going to get into posing, but in pelvic health, one of the things that you focus on is on the use of the breath. Mm-hmm. Can you tell us more about the breath? Because I always talk about, that's what Fit Woman is all about. It's about connecting mind, body, spirit, but when you are moving, to connect to that movement. So can you speak on that from the perspective of an athlete, that mind, body, and that breath? Why is that so important in just lifting, and why is it important, especially when it comes to pelvic health?
So for one thing, we all talk about core. We all talk about core function. You know, most people just assume that your core or your core is your ab muscles, right? And it's way more than that. And the core is a combination of muscles that moves together in concert with each other. Primarily, your diaphragm, which acts as a respiratory muscle, when it moves, so you breathe in, and I always tell people, look at a syringe. You pull the plunger down, the plunger is your diaphragm, and air comes in, right? But when that diaphragm comes down, it presses on the contents of your abdomen, your intestines, your stomach, presses on the pelvic organs. Well, your poor pelvic floor is sitting there. It's got to do something, so it gives a little bit. And then as you breathe out and your diaphragm recoils and everything moves back up and recoils, so too does your pelvic floor. And you average about 36 to 40 breaths a minute. This is constantly happening every time you breathe, or should be happening every time you breathe. So there is that constant communication in your body. It's an automatic response that's happening all the time. For some people, though, that's lost because they've trained their body. Again, we're talking about muscles, and muscles can be trained. They've trained their body to do otherwise. And so now, maybe because of their techniques, you know, their breath holding. A lot of athletes, when they're lifting heavily, they tend to breath hold. They're not breathing through the movement, or they're not doing purposeful breaths with the movement. But you keep breath holding. Now we've got a problem because you're increasing abdominal pressures and you're increasing pelvic pressures, which can add issues. It can cause problems. And this is where a lot of the pelvic floor issues come in, especially with the athletes. You know, now you've got the leaking. Now you might be having prolapse issues. You know, now you might be having some pelvic pain or something like that. So really focusing in on your breath. For one, in people who have pain, it helps to calm the nervous system down. It is like your way, and you can do it instinctively. You can do it on cue. But the breath, you can control your breath, and your breath has a capacity because you tap into your nervous system and you help to calm that down. Similarly, as you're breathing, because it's also functional, you have the ability to tap into the muscles that are supposed to instinctively respond with each breath, namely the diaphragm, the pelvic floor, and so on. So you start to get that synchronous movement. You start to get that coordinated movement. And if everything is working right, then you're not having problems. But what we see, especially in regards to pelvic floor, in regards to athletes, those who are doing heavy lifting, maybe those who are doing high impact sports, you know, Dr. Principal talked earlier about pushing to failure. You know, when you push to failure and you're fatigued, your technique oftentimes can be compromised. Your posture and your positioning, which is necessary for efficient movement, can be compromised. And in these instances, now we're looking at how that's going to affect the function of the muscles that are needed, the pelvic floor being one of them. You know, the breath being one of them, the remainder of the abdominal muscles, you know, being one of them. So that's how we, you know, kind of in summary, how we look at the breath and how it impacts pelvic floor, and how we would train our athletes. We really have to be mindful of that.
And you know, it's so interesting. I've been lifting for 21 years. Yeah, 21 years at this point. And to understand, like, I always looked at breath as a way to calm, you know, so you become less tense and you can effectively train. But I never realized how much the breath came into play when it came to your abdominal wall, the diaphragm. I mean, you know, the diaphragm is involved, but also your pelvic floor. Like, I would never even think about that. It sounds almost dangerous to be holding your breath. You know it's not good, but you don't realize exactly what the dangers are. So now I'm going to ask you ladies this. There is this shift towards the use of, I mean, it's not new, but, you know, people go to chiropractors. They get body work done. They go to massage therapy, myofascial release, cupping. We're seeing bodybuilders use, or physique athletes, or just athletes in general, use these tools. Now, I know that my physical therapist does those things. He does that along in his practice. So I know that that's part of it. But what should one be looking for? Like, I know I'm going to go to his office. Like, I don't go to somebody else separate for these things, but I know that there are people that do them separately. What is body work? What is, you know, chiropractic care? How do you differ from chiropractic care? How do you differ from massage therapy, myofascial? Like, how does your practice differ from that? And I'm going to get back to you, Dr. Principal.
So body work encompasses, I think Tameka is coming on right about now. Hey,
yeah, she's coming on now.
Sorry about that.
No worries.
It's all right. You jumped in right in time.
Oh.
The question was, I saw you fell out, and I was like, all right, she'll be back. So here I'm speaking on the concept of body work and chiropractic massage therapy. How does physical therapy differentiate from that? And Dr. Principal was answering. And you can all jump in when she's done.
Okay.
Body work encompasses PT, massage therapy. Body work is basically the whole soup, you know, if you want to think about it that way. As well as cupping, as well as grasping, that's all body work. And as you said, there are people that just specialize specifically in body work, and there are therapists that do body work as well. There are chiropractors that do body work. There's massage therapists. So we all kind of do it. I think, you know, the forum is for therapists, so I'll speak from my perspective. As a physical therapist, we're taught in that musculoskeletal assessment at base minimum. That's what we're doing. So I'm looking at your active range of motion. What can you do yourself? You know, if I'm looking to, I have a lady actually right now that I'm working on. So she's got this really flat back, you know, she's got this hump right about there that's kind of forcing her forward. So I want to see, you know, is your head range of motion normal? Are you getting adequate active range of motion of your thoracic spine? Are your shoulders working? Because your shoulders and your upper back play a part in the deal. Passive motion is what, so if actively I can move, let's use some numbers, between 0 and 120 actively. Correct. But if I push on you and I can get to 140, that tells me that there's about 20 degrees of weakness that's there that maybe we need to strengthen. So that's active and that's passive. So as therapists, we're assessing motion in that sense. We're also looking at joint mobility. How is the joint moving? Is it the spine has an extension that it needs to do when you're sitting upright? And when your arms raised, the spine needs to extend. So can I do that passively? Or am I getting some motion in there and some play on those spinous processes of the spine? Or is that thing stiff? You know, and therefore maybe I need to gear my body work toward looking at the joint, right? Or maybe the joint is fine, but maybe the soft tissue that's inserting into the spine is not maybe firing or moving the way it's supposed to. So maybe I'm looking at the soft tissue. So from a physical therapy perspective, we're looking at joint, muscle, and then we're also looking at nerve. Is it numb? Is it tingly? Is there some neurogenic or some nerve signs that you're feeling along that area? And then the irritability of the tissue. So based on how irritable it is, we decide upon the strength and the pressure that we therein provide on the example. So the example, I guess possibly is, you know, like a median nerve or like a tennis elbow. Everybody kind of suffers with tennis elbow. You know, you handshake, it's the handshaking kind of disorder, you know. So when you're getting that dysfunction right at the elbow and it's super, super duper tender. I'm not going to go guns blazing, you know, doing massage and things on that elbow because it's really irritable. So maybe I'm going to scale back a bit and maybe just do some really soft tissue on that thing just to get it to calm down a little bit, you know. So that's the example I give. So yeah.
One of the things that I've noticed, you know, sometimes I'll see on social media people having body work done, like Graston. And when the person is done, and I've seen people literally walk away with streaks of bruising on the muscle. And I know sometimes when I've gotten body work done, I'm like, it's not pleasant because they're releasing muscles that are tense, and it's not fun. There are times I find myself, you know, I'm off, scooting off the table, and there was one time, you know, they're going into the scapula, and I'm like this, and my doctor stops. He's like, Orlandina, get back on the table. I'm like, but I don't like that thumb. That thumb. I want to break them. You know, or they're in your, so it's not pleasant, but I have never walked out bruised. So when I ask people, I'm like, well, are you supposed to be bruised like that? I've seen red, you know, because you see the blood, but I mean bruised. And they're like, yeah, that's the correct method. Is that true?
No. More is not helpful. I think that's one of the problems that a lot of people get, because now anybody can go do a weekend something and call themselves an expert. You know, you can have Joe Schmo from down the street go decide, oh, I'm going to take this cupping class and now I'm an expert. The problem with that is his only solution to all your problems is cupping.
Right.
Or you know, somebody goes and takes a Graston class and they're like, oh, I know Graston technique, and Graston cures all ills, and now their solution to all of your problems is Graston. Or you've got and I love chiropractors. I know a lot of great chiropractors. You know, Suze and I went to the same PT school. We're osteopathically trained, so we understand, joint manipulations very, very well, and do it actively in our practices. But there are some chiropractors that will tell you that the solution to all your problems is every time I see you, I have to manipulate you. The problem with that is you have to understand that the body is a system. Systems are made up of multiple components. We need to first and foremost diagnose what the issue is. What is the problem within the system? What do we need to address? So if you are going to somebody for neck pain, like the example that Suze, Dr. Principal gave, if you're going to the doctor and you've got this, posture that's not ideal, and you're complaining of neck pain, or you go to a massage therapist and they massage you and massage, oh, your muscles are tight, and they're in there doing Swedish massage and deep tissue and this, that, and the next, but you don't have appropriate mobility within your cervical and thoracic spine. They can rub from now till the cows come home, and guess what? Nothing is going to happen. You're going to be wasting your money going to somebody who is not going to make a difference. Have they checked your mobility? They don't know what any of that stuff looks like. They come to you, you come to them, and they go, oh, your neck, oh, your muscles are so, well, of course the muscles are tight. Look at the position that they're in. Their posture is compromised. Obviously, the muscles are going to be tight because now the muscles aren't even in the position they need to be in. You may have some shortened muscles at play. The difference, I think, with coming to a physical therapist, and like you can allude to because your therapist does this, but the difference with coming to a physical therapist is, again, this is our area of expertise. We understand the body systems. We understand how they're supposed to function together. We have diagnostic capabilities. A massage therapist cannot diagnose you. Your personal trainer can't diagnose you. That's not within their scope of practice. But we have the capacity to diagnose these issues, and then as such, be able to work with you and give you what you need, again, to make sure that A, you have the right amount of mobility. You're moving well. Address the pain issues. And furthermore, if you're an athlete now, what is that supposed to look like with regards to your sport, or with regards to the functional types of movement that you need to do? If I'm talking, let's say, a volleyball player, and one of my volleyball athletes is coming in, coach, I got neck pain. Let me see you lift your arm up. Because if you're one of my attackers, you need to have mobility. Your shoulders got to get up, but you've got to have arm speed. You've got to be able to be dynamic to get your arm up in the air, get your arm up quickly, be able to swing on the ball. If you've got neck pain and you don't have mobility in your neck, you don't have mobility in your thoracic spine, I already know your shoulder is not going anywhere. You can't hit for me. So now I got to get you working. I've got to get you functioning properly because you're never going to have that power if you don't have the appropriate amount of mobility. You're never going to get that power you need. Perfect
segue, because the next question was, and I know we're going to, we're going to be closing soon, but as an athlete, you create this team. You have your coach. You have your competition coach. Your competition coach takes care of your training. They scan. At least that's my coach. Scans. What are the areas we're going to work on? What are your weak areas? What are your strengths? And this is how you're going to eat. This is how you're going to train. This is the order you're going to train. And one of the things, like I said, I shared with you, I had torn my ACL. I had because of the length of time that I had to wait before surgery, because tore the ACL, sprained the MCL, they had to wait for the MCL to heal before they went into the ACL. So it just created this atrophy. And then while the muscle's healing, Tameka knows this whole thing. It's just the atrophy. So it took so much time to be able to, first of all, get the brain to connect to the muscle, and that whole nervous system, and doing all these exercises to get it back. And then to continue even years after to be able to continue to do therapy. But one of the things that I was saying, what leading to, is the fact that I saw that my physical therapist was a part of the team. Like, I could not do this alone. And if my coach notices a tightness, or he notices that I'm not moving correctly, the first thing he'll say is, something is tight, you need to work on it. It's either body work or you need to go to, and the first thing he'll tell me, go to your physical therapist, because I noticed that you are not moving your trunk correctly, or your quads are not activating correctly. We're doing different exercises to try to get it to connect. But there's a whole system. Like, so my physical therapist, I see as a part of my team, so that I'm able to, address those issues. I'm noticing you're tight. And so the question I have for you is, Dr. Principal, she fell off. She'll be back.
She'll be back.
She'll be back. Oh, she's coming. She's coming. We'll applaud her when she comes back. Here she is. Yay! Now we don't see you though. Dr. Principal, we don't see you. She'll be there. Oh, there she is. Hey! Oh, nope. There you are.
I'm back.
Yay!
I don't know if I can hear everybody. Can everybody say something?
Hey!
I can hear you.
What a mighty God we serve.
Right.
I'm back.
I'm
back.
So I would say one of the biggest things that I've found is, like I said before, I'm an educator. I found my physical therapist to be a great educator. I've learned so much about my body and how it works. And I mean my body, not anybody else's body. But I've learned so much about how my body moves and what I need to do to help become the most efficient thing ever. But I found it to be such a great education, because if I had an injury, once I came out of the injury, I understood how the muscles around that injury worked. I incorporated those PT exercises, continue to incorporate them in my workouts. So you find that not only is your PT your therapist, but also an educator. And what does that education, how is that education valuable to a bodybuilding athlete?
I'll answer that. I think that not just for the bodybuilder, but for everybody. I think, me personally, when you understand what's going on with your body, like, it changes the game. Like, I've had patients where, things have been so far-fetched where conservatively I was unable to, there was nothing that I could do to conservatively help them, whether they needed surgery or whatever. But the one thing that I did do, I educated them. I am huge on education, pulling out anatomy, showing apps to show them this is what's going on. This is why your body is moving the way, this is the problem. And it's amazing to me how many people come to us and they're like, wow, you are the first person that has actually explained to me what's wrong with my body. I had more people refer people to me just because I took the time out to listen, and I took the time out to explain things to them, even if I couldn't help them. But I think it's important that that everybody understands what's going on with their body, but even the bodybuilder, because you have that muscle mind connection. So like we said, in bodybuilding, it's, you using that example, for a bikini athlete, if you're trying to hit a back pose or, figure, I have this problem personally, so I'm transitioning now from bikini to figure. And so now I have to work on hitting that side pose. Well, I have an old SI joint issue that has gone up to my spine, and it affects my lats and it affects my trunk rotation. So I have a really hard time hitting the that side pose. I know what's going on, so I have to do, I can't, it's not just stretching. Stretching won't solve the problem. I have to activate my external obliques, the core, the pelvic, like, it's so many things that I have to incorporate. And me knowing, okay, this is what I need to address. I need to work on flexibility in certain areas, but I also need to work on strengthening here. But now for my spine, I need to work on the mobility of my spine to hit it. So like Dr. J said, it's a system. It's not just, okay, let me loosen or stretch this muscle out and then I'm going to have the mobility. You may have the mobility for a day or two, maybe even 3. Yes. But once you go back to doing the same, and I think this all leads to the corrective exercise or the corrective prescription of things to do. You can go and get this done, that done, and that done. But if you don't do the corrective techniques to continue to address the issues that have been worked on, guess what? In a couple of days, you're going to have to come right back to me because you released it, or you did this, but you didn't correct it. Did you correct your sitting posture? Did you correct, like Dr. J said, did you correct the mobility of your neck and of your spine that's limiting your ability to get your shoulder up? If not, guess what? I can release you. I can do this on you today. And I guarantee you by next weekend, you're going to have to come right back to me for the same exact thing, because we didn't address the root of the problem. We're chasing that's chasing the symptom,
chasing the pain,
and not addressing the root of the problem.
And that's where that whole thing comes in. What came first, the chicken or the egg?
Yep.
So
Right.
What came first, the chicken or the egg? You can continue to get this massage therapy, loosen the muscle, but if you don't correct whatever is causing that mechanic to be off, you're going to be always right back to the same thing. And I wanted to really, because I did say we were going to speak about posing, and I love you. Thank you for bringing up the idea of the chunk rotation. So now you spend your whole year, your whole season, training, and you get on that stage and you need to pose because you have literally 30, 45 seconds, depending on the show, 60 seconds maybe, if that, to show the judges that you are the ideal representation of that division, correct? Now you get on stage, or you've been practicing for weeks, squeeze, open up those lats and squeeze down on the quads. And well, I'm speaking from women's perspective, women's physique. I know for bikini, you got to turn, you got to hit these poses. I did figure for a couple, maybe a year, and just that turn, that model pose. You look great on one side, turn to the other side. No, it's not happening. You don't have
it's not happening. What happened?
I always joke around. I said, Mr. Steve Weinberger is the chairman for the NPC Northeast, so he's the one that judges most of the shows. So I'll be in, I'll go to the posing room and I'll practice. Quarter turn to the right, quarter turn, and there's that one side, it's your weak side. You're like, please go through this quicker so I can get to the best side. And you try to hold it. You're like, yes.
It's gonna be like.
But that one side is just not. You can't hit it. What is up with that? Because the philosophy is you can have the best body, but if you can't pose it, it means nothing. A good poser will beat a great body. It doesn't matter. So what is it that we need to do to be able to understand the mechanics behind posing? And when do we need to come see you to, first of all, don't wait till 2 weeks out, folks. Don't do that.
2 weeks out.
2 weeks out.
Well,
come see them as early as possible to adjust it, because I know I'm going to be there because I need to work some things out. But what can we do as an athlete? You work so hard and for it to be undone because you can't. You can't flex those glutes and squeeze and show what you got. The judges are like, get off the stage.
And next.
Right.
Senator number 105. Get off the stage. So what can we do?
I think. Oh, go ahead. Go ahead.
I think it runs into oh my gosh, so many things are going through my mind right now. So I think the example, like I have a perfect first time exposure. A friend of mine had just started competing in figure.
Yes.
I really didn't have much exposure to the bodybuilding world, but I'm a therapist, right? And then she invites me to see her at a show. This is a great example, actually. And she is one night out from the show. And she's like, but this is all part of the recipe and not knowing, I think. And this is the education piece, I think, which is important. So she's like, okay, girl, I've been really I'm going to do something. You're going to show me, you're going to tell me. And she's like, I got to do this thing. And I'm like, oh, what's that thing? And she's like, I got to open up. I'm like, what's opening up? And so she opens up and she does a lat spread. And I'm looking and I'm like, something's not happening on that right side. And then she's like, well, what do you mean? And I'm like, well, try again. So she stops, she resets, she comes up again, she hits it. Something's just not happening on this right side. So as I'm looking at her, and I'm like, okay, well, stop, and let me just take a look really quick. Come to find out, she had a restriction. So understanding the anatomy. So if you go on Google and you kind of look up lats, and you have to do a lat spread, you see that the lats insert or they go into the spine at a certain level. So if your spine is not necessarily extending, there's some mechanics that happen at the spine. It extends, it flexes, there's some measure of rotation. You know, if that's not happening, then your lat is really not going to fire the way you want it to, and you're not going to get that spread that you want to get. So, you know, I tried to work, but at this point, you're one night out. We did the best we could under the circumstances.
Yes.
And then we go under the other example of what you said, not coming 2 weeks out, that we can all speak to, is that your body is constantly changing. So you can be looking real full and thick 16 weeks out. And, you know, these things are really tight and your glutes are looking great. You're like, whoa, look at these things. And then once you get to 2 weeks out, you have a whole different physique that you have to wrangle and work with.
Correct.
And things are tight in certain places, and it's less the posing, because we're not speaking about posing. We're speaking about the biomechanics of what your body needs to do in order to get into that position and to hold the position.
Because it's not a natural position. No one stands in that.
You don't stand like that, no.
I don't know about you guys, but I stand like that.
Oh, you stand like that? Okay.
Oh, okay.
That's how I pick up my groceries.
I might need a therapist.
My glucose.
Nobody does that. You know, you don't stand in front of anybody with a lat spread going, hello, how are you?
How you doing?
How you doing? You know, no one says, hey, how are you? You know, no one stands. These are not natural positions. So you don't realize that your mechanics are off. You can have the best posing coach ever, and the posing coach will be like, you need to squeeze on that, and that's the bar. You're like, but I am, but you're not. You know.
Can I speak to that really quickly?
Yes, please.
Yeah, I'm gonna jump in really quick. This is double dutch.
Something's happening. Somebody's, is there a microphone or a necklace on the mic? Like, but I am. Okay, whatever it was, that was what it was. Okay, go ahead.
I'm gonna speak to it very quickly. So now having a little bit more experience, someone that I knew reached out to me on Instagram, and they said, "Listen, I'm having pain in my back, and I'm really struggling with my quarter turn, like you said, quarter turn, ladies." So I said, "Well, show me it." I said, you know what? This is what you need to do. Just send me a picture of it. Let me see what you got. So she sent me the picture, and I'm like, okay, I see some things. And then she turns around, and I looked at her back, and she's got scoliosis. And I'm like, do you know your scoliosis? She's like, yeah, no, I didn't know that. I said, okay, well, let me see if I can assess you. And this is all via telehealth. So I'm doing this all via my phone. Mm-hmm. And then it comes out that she's got some low back issues that are affecting her quarter turn. So she can't necessarily rotate because she's got this back issue that's super stiff. And then with that, she didn't have the strength. So she said, I hate deadlifting. She said, it hurts my back, so I avoid the thing. And then what I did was I said, okay, cool. So let me see you deadlift. She said, girl, this hurts. I said, well, do me a favor. Now I'm going to speak to, where are you? That corner?
Yeah.
I'm going to speak to Dr. Joanne.
Joanne is up into your.
I'm right here. I'm yeah, your upper left.
The other way.
This way. That way.
Yeah. Oh, there you
there
go.
She is.
Right there.
Oh wait.
But to that point, what I'm trying to say is that I told her, I said, now do me a favor. I said, get into like a bent over row position. She said, girl, this thing hurts. I said, and she's had children. So a lot of competitors have had kids.
Yes.
The abdominals have been stretched. I said, you know what, do me a favor. Contract the stomach like I'm going to punch you in your stomach. So she tightened down on it. I said, how do you feel? She said, girl, the pain went away. I said, okay. So you've got to work on to strengthen that muscle. And then we worked on some stuff for the lumbar spine. And then I said, you know what? Let me see your quarter turn now. When I tell you that thing cleaned up, so she went back to her posing coach. And her posing coach was like, great, now I can work with you.
That's right. Now I'll take you.
Yeah. A lot of the time, though, with a lot of these athletes that lift, though, they don't have a lot of mobility. No. They do not have mobility. And like you said, you know, you might look like one thing 16 weeks out. Like I don't work with as many bodybuilders. I work with a lot of CrossFit athletes. But even if they're going to go into a competition and they're like, oh, I got this problem, I can't move like this. But they can't move. Like you've been lifting, you're tired, your body's fatigued. And one of the things that people somehow manage to miss is you need to still work mobility into your training. If you can't move, you can't pose. If your spine can't move, if your hips can't move, you can't pose well.
Because the thing is, when you're lifting, the premise of lifting is that old school lifting. Your deadlifts, your squats, your bench press. That other stuff is considered newfangled. That newfangled stuff. That fancy stuff. That fancy
them young folks.
Them, the millennial stuff. But meanwhile, mobility is extremely important because you see it. A lot of athletes are very stiff. When they walk, they're very stiff. And that's one thing that I'm like, I do not want to be stiff. I know that I'm stiff here. My shoulders could do more mobility, but that's why I do my stretching. I even do an online stretching on Sundays with everybody. I'm like, hey, join me for my stretching. I do not like that feeling because I know that that lack of mobility will lead to injury because now everything is tight. You can pop, you can snap, you can tear so easily when you don't have that mobility. And I think that's something that needs to be really expressed to certain bodybuilders. Do it. Some of them are mobile, some of them are very flexible, and others are not. And I think that's something that needs to be brought into the sport or shown more. But I think more and more people, because now people are getting body work done, but I think they're doing it from the perspective of loosening up their muscle, but not understanding that we need to continue to do certain things and stretch and know how to stretch and stretch specifically for our sport, not just touch your toes, calf stretch, a little behind the head kind of thing. But I feel that's the stretch done. That's 5 minutes. I'm like, but you're gonna train like 2 hours on that, And I need to make sure that I incorporate it. But what I do is I try to do my stretching in the morning because I feel the difference. I know what happens when I don't. So I'm going to come back to you, ladies, with that to close. My gosh, I can't believe we're done. Oh, this is great.
I didn't even get to talk about prolapse.
I know. I wanted to.
And all the pelvic issues. We didn't even get. My BFF is sad.
Listen, Dr. Juan, we got to come in. We got to do this again. I think that the information that we were able to share here was so valuable. I think it's something that I know that if anybody wants to get in touch with me, we can go ahead and reach out to them. You find their information on the flyers. We add them. We have Dr. Tameka Duncan of Vitality Sport PTrehab. You have Dr. Principal of Principal PT. You have Dr. Juan, Dr. Juan Michelle Martin of
J&M Health Solutions. I got you, girl.
Exactly. So you can find them and get their information. If they're out of state, they can do telehealth conferencing with you, and you can get the information that you need. And if you don't have it, don't worry, contact me, and I will definitely do that. So, ladies, I would like you to close off by answering this statement. A good physical therapist is blank, but an excellent physical therapist is blank. I'm going to start with you, Dr. Juan Mitchell.
Michelle Martin.
Michelle Martin. Oh my God.
Oh man. I think a good physical therapist is skilled and knowledgeable. I think a great physical therapist listens. Because it's one thing to have a skill and to have the skill set. I mean, everybody can do, but we're not just technicians. Our ability to be able to diagnose comes inherently from that skill, the skills of being able to listen and the skills of being able to communicate. So I think that's super important.
Dr. Principal, a good physical therapist is blank, but an excellent physical therapist is blank.
A good physical therapist is a technician, so they're able to kind of just technically run through the skills and the things to get the job done. I think a great physical therapist is actually an educator. I think inherently, because of what we do, I think education is power. So if I know what's wrong with me and I know the reason why I'm here and I know essentially what to do, I think that will catapult me into better results.
Love it. And Dr. Duncan, a good physical therapist is blank, but an excellent physical therapist is blank.
I don't want to sound cliche, but they literally took what I was gonna say.
Yeah.
You know,
Sorry, girl.
because seriously, I mean, that's the truth. A good physical therapist, yes, they have a bag full of tools that they can pull from, so they have skills. But a great therapist, they're a listener. I was always taught when I first started as a student, your patient will always tell you what's going on. You just have to have the skill to listen. If you listen well, your patient will tell you exactly what their problem is. And then based on your listening, then that's where you investigate further. So I would say a good physical therapist has skill. A great physical therapist is an investigator.
So an excellent or a great physical therapist is a listener. They are an educator and they're an investigator. And ladies, thank you so very much. I don't know if you want to have any closing thoughts as to where you can be found. So I'm going to allow you, please just go ahead and tell everybody where to find you.
Quick question before we close. Do we have any questions from anybody?
Does anyone have any questions for the ladies? I see we have some viewers. So if you have questions, go ahead and drop them. Somebody said phenomenal information, ladies. Thank you. So if you have any questions, go ahead and drop them down below, and you can definitely leave them open. They're watching. They're quiet.
I know someone had asked earlier on the Instagram feed what leaking was. So when I say leaking, that was referring to leaking of urine. Typically not feces, but leaking of urine, which is common with a lot of athletes who participate in any type of impact. So a lot of the CrossFit athletes who are doing, they're doing double unders, sometimes with their running, or if you're a bodybuilder and you're, maybe off-season training and doing more running in your programming, or also those who are doing a lot of loaded work. So when you're doing really heavy squats, and they're in that, that you're in the hole basically, and you just can't control it. You have no strength, everything is let go, and literally everything is let go. So a lot of the times with the loaded movements, a lot of women will find themselves leaking with those particular movements as well.
We have a question here. What's the best way to fire glutes?
It depends.
It depends.
It depends. What's your hip mobility like? Like if you don't have good hip mobility, you're not going to be able to go through that proper range of motion to activate the glutes. Is something going on with the lumbar spine? So it depends. It really depends.
Might have to externally rotate to cheat.
Externally rotate, right?
Externally rotate and cheat.
Right. Well, ironically, to that end, I had someone, say that too. She was trying to kind of instruct on glutes, and she said, "Listen, if you're really just suffering and you're struggling, externally rotate your hips and just kind of clamp down, and you can get them to fire that way as a compensatory, as a compensation."
But is that something that's going to be long lasting?
That's what you're going to learn the day before your competition. That's what happens when you come to the therapist the day before and you're like, I need this to fire. Look,
rotate that here. Yeah.
Pretty much.
Yeah.
Pretty much. But then as they grow glutes, you'd be monitoring to see how they're firing and then go from there. Like Tameka was saying.
That's what I'm working on right now. Firing those glutes. Thank you, Dr. Duncan. So firing those glutes. Go ahead.
I had someone in my feed posted, how do you know if you are with the right therapist? I think it kind of alludes to what we said. So if you have someone that listens, they listen, they're an educator, and they investigate, not someone that's just saying, okay, not a therapist. A good therapist is not a cookie cutter therapist.
Amen.
You hear so many, I've heard so many stories where people say, yeah, I went in and they just threw heat on me and they had me do the bike and then they had me go through these few exercises and that was it. Okay, did you get better? I didn't. But you know what I mean? So I think you're with the right therapist when they listen, they investigate, and when they educate you. And then based off of all of that, then they create a specific program specifically to you to address that, to address your issues.
Next question. Why do hamstring injuries take so long to heal?
Bigger muscle group.
Blood
flow, bigger muscle group. And it really depends on where the injury is in the hamstrings. Is it higher up? at the attachment point? Is it in the muscle belly? And usually because of the amount of torque that you're going to have to utilize in those hamstrings, I mean, you're using them all the time. You know, it take a lot longer to heal because you're constantly aggravating it.
There was a really good study that they posted a MRI of a hamstring that was strained, perfect example. And it showed kind of the lack of vascularization that just happened within that muscle itself and why it takes so long. So you see the redness and the fullness on the MRI of this hamstring, and then you look at it post-injury and it's just like white. So you almost have to revascularize and get the blood in there again. And that's why it constantly gets kind of re-injured because of that reason as well. And then as Dr. Martin said, in terms of like, where is it insertional in the glute, or is it a little bit lower? As to where it is.
Tameka Williams says that you are all advocates for optimal health. Yes. Yes, absolutely. Any more questions out there? Our Instagram feed was done after an hour, so people, I'm sure they're going to have questions. It's going to be filled up with questions in your inbox. It was funny because when I posted the videos of you ladies doing your manipulations, the numbers kept rising. I was like, what? I said, to a point, I said, you know what? People have been locked up in the house so much that I got messages in my inbox saying, I need that in my life right now. I need this. I need it. I was like, okay.
Can we speak to that really quickly? So there's ways that actually you can so if you do telehealth, so some of us provide telehealth services. So these are services that are provided via the phone, via Zoom, or whatever platform that is. And essentially we can teach you how to manipulate yourself as if we were there. And if done correctly and or with, you know, a skilled therapist, they can kind of bring you through as if we were there with you to help kind of manipulate the same way. Got
it. So how can you see people now? I know with COVID-19, the practice is being changed. So, or you may not be seeing people in your offices right now. So how do you still talk or be able to walk people through, or just to even see what's going on?
Virtually, via video platform. You know, my practice started as a virtual, as a hybrid practice. So I was doing home visits and virtual visits. And so this hasn't been much of a shift for my practice in particular, but we're still able to see people. Again, it goes back to the listening, the communication, and the diagnostics. You know, you can still do all that in this video format. So as we're sitting here, I can see you, I can talk to you, you can see me. I could have you get up and do a movement. You know, I can have you, listen to you, find out what it is that's bothering you, have you go through a series of movement if I need some more clarity on how you're moving and what could be problematic. And then based on what's happening, still continue to create that program for you, you know, address the pain, address the issues that you're having, the dysfunction, but most importantly, address and help you to get back to whatever your ultimate goal is. Because like I tell people, I don't care about your range of motion. I care about whatever it is that you want to get back to doing. There may be some people who are like, I just got to get ready for this competition, or I've got to be able to play my sport, or I just want to get on the floor and play with my kids. Yeah. You know, so the goals are going to be different for each person. You know, you could have somebody with back pain, but it could be as simple as I just need to be able to sit, 8 hours to do my work. I just need to be able to lift my baby, or I need to be able to pose for my competition. So really understanding what people's issues are and understanding what their goals are and what it is that they want, and just giving it to them. Just give people what they want.
Gotcha. Dr. Duncan, you had your hand up? Mm-hmm. Okay. So she's like, yeah.
Oh, no, yeah. I was going to say, Dr. J will be great at answering that question.
Yeah.
When she asked about, that's what I was saying. Yeah.
About the telehealth. Yes. Yeah. Somebody else said, this is my friend, my sister in fitness. Marie says, yes, I need that in my life for sure. And so, Dr. Suze is right here in New York. So anybody wants to see her, she'll be seeing me.
Don't worry. If they can't see Suze, they can see me. I'm still licensed up there. We've got a few states between the three of us.
Yes. Yeah. I think we got the whole board covered.
I've got 3 covered.
I got 3. I'm working on 4. North Carolina apparently needs me. I need to be in North Carolina.
And just understand that all three doctors are available to speak with via telehealth. Every one of them, if you have questions, especially I saw that one of our viewers, Kaidi, was very, very much interested in the pelvic health. So I know she wants to get back to life, and which is what all three of you do. You know, like you said, Dr. Michelle Martin, it was just that the fact that you want to help us all get back to life, get back to what we do every day. I know for me, like if I couldn't do what I do, you know, I teach during the day, and then I'm an athlete by night, and I own my own business. But if I could not get back to that, that would really be upsetting. So anything that you can do to help me get back to life would be extremely important. So, ladies, are there any questions?
I have
comments?
posted one more question.
Yes.
Why did each of you all get into physical therapy?
Ooh, good one.
Oh, good question.
Oh, somebody said, yes, we want to get back to life. Yeah.
Oh.
Yeah. I was an athlete. It involved movement, and I wanted to be an orthopedic surgeon at first, but having an injury as an athlete in college and just my experience with the orthopedic surgeon was not great. And ultimately, that wasn't the person that I saw for the most of my time. When I was injured, it was, you know, my athletic trainer, physical therapist, my coach. Those were the people that I saw. And I was like, that's what I want to do. I want to be with my people every step of the way, not just have a snapshot into what's happening. And so that's when I made the switch to PT.
Wow. Dr. Duncan?
Same here. I was an athlete growing up, and I always knew I wanted to go into the medical profession. And so for me, I was introduced to PT when I was in junior or senior year of high school. And simply what the teacher said, she said, physical therapists were those who were many physical therapists were athletes who had a desire to go into the healthcare profession. I was like, that's me.
That sounds like me.
And hey,
Howard,
I went to Howard for undergrad, and Howard had a pre-physical therapy program. So I enrolled in it. And then that summer I volunteered in a clinic, and I absolutely loved it. I loved the idea that I could still be amongst athletes, but just be amongst them and help them in a different way than, than being out there necessarily. So that's what did it for me.
And Dr. Principal?
I wanted to be a physician, but I realized, same thing like Dr. Juan, that I like results. And I like to see it along the way, and to know that I can start with someone and they can't walk, and by the time they're leaving, they're running, is amazing. Yeah. And every time that happens, it's almost like you get your degree for the first time because it's so fulfilling. The other piece for me is it along the way, I realized that for personally for me, it's also ministry. So I find that we're in a profession now, granted, you've got COVID-19, but I'm still seeing patients in person. So I'm getting the more, I'm getting like the pelvic fractures, the hip replacements, I'm getting those things that are coming in addition to some other things. But, I'm able to touch people. And in that sense, too, you can see how it transitions the mind, and it transitions to how they, because some people are really suffering right now, and people are really feeling depressed, and you can actually sit there and have a conversation. And granted, I'm not all upon you, but I still can touch you. And I think it was a patient at one point that said to me, you know what, I appreciate your ministry. And it didn't hit me until one day. And I said, you know what, it is a ministry because we're healing people. And you're almost like Christ. Who can walk away and say, like, I'm doing something that's going to actually impact your life in a positive manner. Yeah. And then I was introduced to it as a child. I actually had a really bad car accident. And then I was in therapy myself for it. And this is back in the days of diathermy. So if you guys remember that diathermy. I had diathermy.
Stop aging yourself.
Google it. Google it. It's old school.
Everybody's not know what that is.
Stop aging yourself. Then you go start talking about traction when you had the weights and the pulley.
Oh my gosh.
Overdraw traction. But yeah, so I got into an accident, and so between that, it changed my life.
I have a question here. I have issues with movement when I've been stationary for a time. Where do you think the issue is sourced, and what is your recommendation for treatment? So I'm going to say it again. I have issues with movement when I've been stationary for a time. What do you think the issue, or where do you think the issue is sourced, and what is your recommendation? So what do you think is the source of the issue? And what
the lack of movement. You're not moving. If you're stationary, you know, it's one thing to say I'm stationary, but let's say, for example, you know, everybody right now is sitting, they're working from home. What is your workstation looking like? You know, how are you sitting in the chair? How long are you sitting in the chair? You know, are you getting up and actively taking breaks? You know, what does your posture look like? You know, are you like this sitting at a computer? Are you slouched? Are you slumped? And then, you know, multiply that by how many days you're doing that, how often you're doing that. It's not just usually I've done this for one day and I feel like crap. It's usually you've been doing this for the last 8 weeks that you've been home and now you feel like crap. Yeah. So the key is going to be get up and move, you know, change your position, change if it's a workstation issue, then you got to improve your workstation, you know, making sure that things like your knees are in line with your hips. You know, if you need to get something under your feet to position you better, do that. If you need to lift the screen up so that you're here, not here, you know, get your keyboard set up better. Things of that sort. If you're Netflixing, because that's a verb, you know, and you're on the couch, you know, and you like in your favorite position. And so now your spine is in like this flex position on one side and you just hear and this hand's going numb but you Netflixing because you know what? It's a marathon, right? Because you got to watch all them episodes, you know, stuff like that. You just got to be cognizant. Can you tell the conversations I have with my patients?
I think that's because I'm Netflixing. But you're absolutely right. Like even for me, I'm at my desk for hours. So now I'm like, you know, I realize my neck is stiff. And so what I did now is I put books underneath my laptop so I'm not hunched over. And I wanted to ask, since you put it out there, where can we get that kind of information as to what is an ergonomically correct workstation? Have you ladies written an article or a blog? You know, where could we find that information? I know for me, so I'm sure a lot of people have that. How can I make my workstation ergonomically correct so that it is physically friendly? Like I actually have a little footstool that I put underneath my desk because I noticed that my hips were always achy and I just put the footstool underneath. So what are some things, or where can we get that kind of information? Should we go to your website or to make that happen?
I have a diagram of an ergonomic workstation that I often provide. I think it's pretty detailed and, you know, it's simple in explaining proper positioning. So I can provide that and we can outsource it if people want to email us or email you, and then we can get it to them that way. Mm-hmm. So
if you want that information, folks, you can definitely email me and I will send that information to the doctors, or you can email Dr. Duncan, or what we could do is you can email me and then we'll get it to you, an ergonomically correct workstation. So I can probably put it on my website as well so that you can get that information. But yes, any other questions? These are great questions. You guys have questions on your platforms?
Let's see. Looks like all my questions have been answered.
Yeah. All right. So now we're going to close, I guess. These are great questions, fam. Ladies and gentlemen, I want to thank you again for joining us. Thank you, Dr. Duncan. Thank you, Dr. Principal. Thank you, Dr. Martin. I got it. Dr. Martin.
Yes.
Dr. Juan Michel.
You know what? You should be an expert at this. All you French people and Creole people say my name right.
Juan Michel.
Yes, say it like you're home. Say it like you're home.
Juan Michel.
Juan Michel.
Michel Martin.
Juan Michel Martin. Juan Michel Martin.
Juan Michel. You know what you hear?
Juan Michel Martin.
You know.
Oh, we have a question. Will your information regarding the ergonomic ergonomically friendly workstation. Will that include a stand-up desk?
This one doesn't, but I can find something for that. Absolutely. So
you heard that. So she will provide that as well. And I'll have that up for you guys by the end of the weekend, by Sunday. So if not, you can always reach out to Dr. Duncan, Vitality Sport and Rehab. Vitality Sport, singular, and Rehab. So you can and you can reach out to her and she can get that information to you. Or you can reach out to Dr. Juan Michel Martin and or Dr. Principal as well to get that information in regards to a workstation, ergonomically correct workstation, because I will be looking at that. I need a new chair, Dr. Duncan. Ladies, I need a chair because this chair, this was not made for this. This was made for like
bottom.
Yeah, this was not gonna work because it was not made for that. When I bought it, it was cute. I didn't know I was gonna be sitting in it this long. Now it's not cute anymore. It's not cute when you get up and you're doing one of these things. I'm like, oh no.
You sit in it for like 20 minutes and all of a sudden the cushion just disappears. Like, where'd it go?
What happened to it?
What happened to it?
No circulation in the glutes.
No. I'm like, my butt's getting
See, that's why you can't do that turn. That's why you can't fire those glutes.
Because I'm sitting on them.
You're sitting on them.
No, actually on my watch, I have a watch, and I actually, it'll tell me you haven't been moving. So I'll get up and I'll stretch and then I'll get back into my seat. Because if not, I'll just start hurting. I'm like, what is this? So, so we will get that information to you all because I know a lot of you are suffering like me. And I can't be stiff because summertime is coming and I want to be going to my little soca and zouk parties, and I need to be able to get down and, you know, that stiff back. I was dancing this morning. I had some music on, you know that song, Brave, Brave. And I'm saying, like, yeah, and I got down to a part, I was like, oh no.
Like, no.
My lower back, and I was like, oh my gosh, this chair is ruining my life. I can't be like this. No, unacceptable.
He said no.
Unacceptable. I need to be able to play it by, dance my compa without restriction. So it's not just about working out, being able to dance this summer too, you know? Yeah. So. All right, ladies, thank you so much for joining us. Fam, again, Muscles and Stilettos is all about bringing information. It is about introducing you to different services and products all out there to help you lead your healthiest, fittest, happiest life ever. Thank you for joining us on Muscles and Stilettos. Doctors, thank you again for joining us. And I look forward to doing this again. And have a great night, fam. You can find this interview on the Facebook page. It's also going to be uploaded onto YouTube, and it's going to be found on various platforms as well, wherever Muscles and Stilettos is found on the Root Range TV network. So you have this information at your fingertips anytime you want. And again, you can always contact the doctors. Fam, be bigger, be fitter, be stronger. Be good to you.